So, hey there. So, it's Chris's Corner. It's a wonderful evening again. And I have the pleasure of announcing a wonderful author. He has a lots of experience with adolescence and addiction. Please welcome Mr. Richard. How you doing,
Thank,
Rich?
thank you, Chris. Thank you so much for inviting me to the program. It's a pleasure to be with you here and talk about this topic of adolescent substance abuse.
So, talking about adolescence and substance abuse, where you mean like we look at a world right now, 2022, in
Yeah.
your eyes, what gives you, I guess, authority to get put a say on it? Like, what experience do you have with adolescence and substance abuse that gives you a little bit more edge than myself? Which I'm not a doctor. I've gone through trauma, but I'm no doctorate, no degree, no counseling, nothing. So tell the viewers a little bit more about why they should listen to you.
Well, I've had a long history of working in both education, mental health, and substance abuse. I actually started out in education for over 30 years and then
Oh wow.
transitioned into mental health and substance abuse. And went back to the University of Illinois, received a master's degree in addictions counseling, and then spent over a decade working at Menninger Clinic in Houston, Texas. Menninger Clinic is a large psychiatric hospital that treats both adolescents and adults who have what we call a mental health as well as a substance use disorder, a dual diagnosis. And I worked there for over a decade treating both adolescents and adults who have a substance use disorder. And over that time, I worked with many families and parents whose children are addicted to substances like marijuana or alcohol or more hardcore drugs. And I would go through their child's history of using a substance, and they would look across at me and they would say something like, "I had no idea this was going on." Or if they did suspect their child was using a substance, they might say, "I sort of thought something was going on, but I didn't know it was this bad." And these are good parents. These are very good parents. They missed the warning signs because nobody told them what to look for. So when I left Menninger Clinic, after a decade of working with adolescents and adults, I decided to write my book to give parents and other people basic information on adolescent substance abuse.
Wow. So that definitely gives you an authority base on to talk about this topic.
Yeah.
Um, you really hit the nail on the head with what you said about people didn't even think that their child had
Yeah.
substance abuse. Now the question is it that the signs weren't really there, or the parents weren't educated enough to see the signs being there? And being a parent myself, with two little guys, I'm not saying right now I'm worried, but probably I'd say when they're 15, 16, 17, that's when I started being a little ruffian. So, yeah. Um,
I, I think, Chris, these are good parents.
okay.
I think they were good parents doing the best job that they can. And they missed the warning signs because nobody told them what to look for. Nobody ever told them these are some of the warning signs you should look for. So they miss them. And then they sort of get caught off guard when they find out that their child has been using a substance. And I would say that every child is vulnerable to being captured by alcohol or drugs. There is no child that's totally protected. There's protective environments, but no child is totally protected. It doesn't matter where you live, urban, suburban, rural area. It doesn't matter what your level of income is. It doesn't matter what school you send your child to. Every child is subject to becoming captured by alcohol and drugs. And part of the reason for that is because these drugs are readily available to these kids and they know it.
Do you think that you made a good point? Readily available,
Yeah.
along with social media videos, movies depicting either drugs are cool, smoke some
Yeah.
pot, or drink drink, whatnot. Like, in the movies, like Narcos. I'm not saying, yeah, I like Narcos. It was a great movie, but they are idolizing gangster or mafia, type of behavior,
Yeah,
which people starting to be that's a common norm. That's cool. Where
yeah,
in those countries, that's life or death. Like, if you gotta make bread, and if you can't make bread, your family doesn't eat. And but
right.
here, being in Canada or the States or Western countries, or in Europe, it's a little bit different where we have more choices, more options. Do you think it's the culture as well, or is it more just the accessibility and or maybe lack of education?
I think there's two issues, Chris,
Yeah.
that drive the adolescent substance abuse. The first is availability. These
Okay.
drugs are available. Kids know they are available. For example, when we ask high school seniors how easy is it for you to get marijuana, 85% of them tell us it's no problem. When we
Yeah.
ask them how easy is it for you to get alcohol, 90% of them tell us it's no problem. And they even report it's easy for them to find drugs like cocaine and amphetamine and
Wow.
tranquilizers. So these drugs are readily available and kids know that they're available. The second issue, though, is harmfulness. These kids do not think these drugs are harmful.
Hmm.
When we ask high school seniors, how harmful do you think it is to smoke marijuana almost every day? Only 22% think that's harmful. Smoking marijuana almost every day, only 22% of them tell us they
Wow.
think that's risky. And we ask them, well, how harmful is it to have one or two drinks of alcohol nearly every day? Only about 22%
Your
of them
liver
tell
would
us
be
they think that's
shot.
harmful.
Your liver would be shot in 20 years. It'd be gone.
So you
I get that.
combine the two, the drugs are readily available and the kids don't think they're harmful. You have what we're seeing out there now.
So another question that came to my mind was like, I came from a very strict family, no alcohol at all.
Yeah.
I,
Yeah.
I went down, I rebelled, of course, and like you said, in high school it was quite accessible, and I enjoyed that accessibility. At the same time, my being now on the other side of going, hey, maybe when the kids grow up, instead of saying bad drugs, creating an environment in supporting that testing behavior so that you could protect them if things do go south. I'm not saying the whole Coke. No, 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 no. I'm just saying if you want to drink a little bit or smoke some marijuana, there's an environment here that's safe, that I know that you're not going down the street in the corner. Is that a bad mentality to have? Is that like being someone like I don't know. I'm just curious.
I can tell you what the research shows. And
What does the research show? I'm
the
curious.
research shows that in those households where parents say, I don't want you drinking outside of the house, but it's okay that you drink here. You can
Yeah.
drink in our home, but I don't want you drinking anywhere else. The research shows that those kids, when they leave home, end up drinking more than
Damn.
kids that came from a family where it was very much discouraged that there be any drinking at all. So, this idea that you can have your kids use substances at home, but
Yeah.
not away from home, is likely to backfire on you.
I didn't know that. And now my theory, I'm glad that you've talked to me about this. No, it's good because I
Yeah.
had no clue. You know what I mean? Like there's no way. It was just what I was brought up with in a very harsh environment. And then I rebelled massively. But I guess so then I guess, all right. So if the environment is not, you know what I mean, if being a parent, you can't support them. But then what do you do? Like, I don't want to get too much into the book, but on the basics of what does a parent do in order to support their child with drugs and alcohol when my theory just went down in shambles?
Yeah. Well, what you do is, I think at a very young age, if you have children that are pre-teenagers,
Yeah.
8, 9, 10 years old, I think at that stage of their age, what you focus on is teaching them about the brain. teaching
Hmm.
them what the brain does, what the different areas of the brain are. You know, we have an area of the brain that helps us speak. We have an area of the brain that helps us walk. We have an area of the brain that helps us talk. And we have areas of the brain that help us make decisions. And teach them about the importance of the brain and protecting the brain. Our brains are in the process of developing until we're around age 24 or 25.
I
And
didn't
that's
know
one of
that.
the things that makes substance abuse so dangerous for adolescents. Their brains are very vulnerable. They're developing. So when you introduce substances into that developing brain, you run the risk of doing some damage. So I would begin, if your children are pre-teenage, just simply educating them on the brain. Get them
Mm.
interested in the brain. Get them to understand what the brain is and how important it is. And then as they move into the teenage years, now
Hmm.
that they have an understanding about the brain, you can introduce discussions on how drugs affect the brain
Oh,
and
so you give
how.
them a base. So what you're saying
Yes,
is you give them the base understanding or the base
yes,
vocabulary or verbiage so that when you start going the consequences, they can actually get it. They're like,
yes,
dude, like use their own critical thought of going, yeah, but if I take this sip, my dopamine receptors or this or that gets enhanced and
yes.
I feel this way.
Exactly. That's exactly right.
Interesting.
And I think once you capture their attention, and what I found is that even with teenagers, the teenagers that I worked with when I was at Menninger Clinic, it didn't do me any good to tell them drugs were illegal. It didn't do me any good to tell them that drugs were bad for them, or if they continue to use drugs, they might drop out of school, or their grades might decline, or they might not get a job or go to college. They didn't care about all of that because they didn't believe it. But what
Mhm.
they did, what they were interested in, what captured their attention was when I started to talk to them about the brain and how the brain works and how drugs affect the brain. They were very much interested in that.
Why is that? Why talking about the brain gravitates towards adolescence, but other things don't?
I, I
From your
think I think
perspective.
I think that their curiosity. They
Yep.
they want to learn things. They're very interested. Once you introduce the brain and how it works, it somehow captures their attention. You're not lecturing to them. You're not telling them they should do this or they should do that. You're talking to them about the neuroscience of the brain and
Mm.
how the brain works, and that they're interested in. And then I would shift the discussion because these were teenagers. I would shift the discussion over to how drugs work in the brain. For example, I would show them a picture, a graph of the brain, and they
Mhm.
could see on the picture the different areas of the brain and what they were responsible for and what they did. Then I showed them a picture of where marijuana attaches itself in the brain, and the light bulbs went on. They could immediately see where marijuana affected their brain. I showed them what the brain did and what the areas of the brain were responsible for. And then I showed them where marijuana attached itself into the brain. And they could immediately see this is why I have a problem with my short term memory. This is why I have a problem with coordination when I'm under the influence of marijuana. This is why my thinking is not so clear because they could see how marijuana attached itself to the brain.
Mhm.
Now, many of the effects that we see are not readily available. They're not observable, but I have seen
Hmm.
them when the psychological and neuropsychological tests come back on these kids. These kids, when I worked with them at Menninger Clinic, were very bright. Their IQs were above average to superior, but they were
Hmm.
smoking a lot of marijuana. And when the test results came back, what I noticed was that the processing speed of their brain was below average, their short term memory was impaired, and their motivation was really very low. Now, some of those you don't notice in observation. Those effects come through in testing, but it's an indicator of how a drug like marijuana can interact within an adolescent brain to
Hmm.
make some changes that affect that child.
Interesting, because I know for myself, being in Canada, it's legalized here, and I know in the States, there's quite a few states that
Yeah.
marijuana is legal. But it was interesting in how when I first came over from Australia, or Australia is illegal. So, you know what I mean? So, to have a joint, I was like, yeah, whatever. I was stressed, but I found for myself, what I'm noticing is I think I'm either ADD or ADHD. I have at least 3 to 5 thoughts always in my brain, and I'm always go, go, go. But what I've realized when I started smoking marijuana, it felt like a for myself, it was a dark cloud. And I didn't really, I felt like stagnant, if that's the right word, stagnate.
Yeah.
Anyways, I gave it up. And I just started to appreciate it. I was like, you know what? This is me. This is how I am as a human being with, without anything. You know what I mean? And if my thought process was, if the Dalai Lama or the Buddhists or the monks or people can meditate and they can manage their thoughts, I want to try to work on that way.
Yeah.
It's harder. It's 10 times harder, but the long-term effect of that helping you long-term is greater. But the question I'm going to ask for you is that I know quite a few people that smoke marijuana and they have trauma, and or they do mushrooms, and it's been known to help out with, PTSD. However, my question is there a balance, or can you just overdo it with one? Is it the body's physiology to handle it or not handle it? Like, from your perspective, dealing with addictions and teens and adolescents, like the new emerging trends that are coming up, like marijuana, the magic mushrooms, and then the microdosing LSDs. What's your take on that?
My take on that is the same for all drugs, all
Okay.
illicit drugs. Adolescents should not be experimenting or using them, again, because of the developing brain. We draw a distinction between adults and adolescents,
Mhm.
because the adolescent brain, as I've said, is in the process of developing and maturing until we get to around age 24 or 25. So introducing any substance into a developing, maturing brain runs the risk of doing some real damage to that brain.
And what are some consequences, say for the viewers that maybe may not know, of let's go the marijuana route and maybe we'll try a couple things, and from your perspective, what would the consequences of overdoing marijuana be for
Well,
someone under 24 in your
Well, I've seen it affect people's short-term memory, so they have
okay.
difficulty remembering things, which can be really critical if you're in school. If you're in high school or junior high or even college, it could affect your ability to recall information that you might need in a course or take a test. So it does affect, in some people's, short-term memory. It also it can affect the processing speed of the brain. So your brain's just not clicking along the way it should be. It may be more difficult for you to capture information and process that information in a more effective way. It could also slow you down. So, some of these effects could really affect a student's ability to perform in an academic setting.
Okay, so that's marijuana. Now let's talk about alcohol. Like, what have you noticed that when kids start drinking a little bit more, what are the difference between, kids overdoing it on alcohol compared to marijuana? I know people are like, "Oh yeah, I know what that's like," but some parents don't have a freaking clue. Some
Yeah,
parents don't know.
Yeah, well, alcohol again, affects the adolescent developing brain as
Yeah.
every other substance does. Alcohol can be very risky, particularly if you have a child who is of driving age and operates a vehicle. But even under the influence of alcohol, adolescents and adults uh, take on behaviors and risks that they might not otherwise do. So you might have an adolescent, for example, under the influence of alcohol or drug, who
Mhm.
engages in unprotected sex, who engages in risky behaviors, who engages in activities that could be dangerous, the driving under the influence of a substance, for example, um, or simple activities like skateboarding, riding a bike, riding driving in a car. So all of these activities, which are very common, very ordinary, become potentially very dangerous when an individual is under the influence of a substance which can affect their mind and their judgment and their motor abilities and their judgment.
Hmm. So my question that I'm gonna bring up is, what about the topic of like a glass of wine is, good for, good for the heart or whatnot? Like what, as an adult, let's take away adolescence for the moment. Now,
Okay.
smoking a marijuana joint or a glass of wine regularly, it's not, three joints, just one here or there, take away the pain, or, just chill out. Is that behavior going to create long-term effects in their life? And if so, what have you noticed in that manner, if you've noticed anything?
I don't think that's necessarily going to create any long-term negative consequences. A person who might have a glass of wine in the evening or a glass of wine every now and then,
Yeah.
a person who smokes a joint of marijuana every once in a while, that's not going to be the end of the world for them.
Hmm.
There always is the risk, and I think they need to be careful of the risk that that one glass of wine turns into two, and then two turns into three, and
Yeah.
then three turns into four. But adults have to be responsible for their own behavior. They have to know what the risks are. They have to be careful, and they have to manage their own use. And if they do that in a responsible way, having a
Mhm.
glass of wine every once in a while might actually be beneficial in some situations.
That's awesome. Well, okay, so one more question that's come up is, I've been told, in families and generational families, my grandpa was an alcoholic, his dad was an alcoholic,
Yeah.
and then my dad's an alcoholic, and I have like 80% chance of being an alcoholic. Now, part of me is just like, well, if you believe it, that's what's going to come out of it. But is there actually supporting facts that, yes, you have 60% more prone to, alcohol kicking your butt?
Yeah, that's a great question, Chris. What we do know is that 40 to 60%, 40 to 60% of a person's vulnerability to become addicted to anything is purely genetics.
Oh, wow.
Um, but that's no different than any other disease. If you have hypertension in your family, you're more at risk of getting hypertension.
Hmm.
If you are a woman and you have breast cancer in your family, uh, what does that mean? It means you're more at risk. If you have diabetes in your family, what does that mean? It means you're more at risk of getting diabetes. Doesn't mean you're going to get any of these. It just means that because it's in your family history, it's in your genetics, you're more at risk. So if 40 to 60% is genetics, what's the remaining percentage? The remaining percentage is environmental factors, high levels of abuse, high levels of stress, any type of trauma, any type of psychiatric or psychological disorder. Many of the people that I've worked with, whether it's adolescents or adults, what I've noticed is that in the large number of cases, these people are using a substance to medicate an underlying issue. Most of the kids that I worked with who were smoking marijuana, when I asked them to help me understand why they were smoking so much marijuana, the answer that came back was, it helps me with my anxiety. It helps me with my anxiety. So for some people, not everybody, but for some people, there may be an underlying issue why they're using a substance, whether it's marijuana or alcohol or whatever it is. It might be anxiety, it might be depression, it might be some type of post-traumatic stress disorder, it could be an emerging personality disorder. And unfortunately, many times or often, these underlying issues go undiagnosed and untreated. We focus on the drug use, but we forget that there might be an underlying mental health issue that also needs to be diagnosed and treated. It doesn't do me any good to treat the kid who's using marijuana if I only treat the marijuana and I can't help him with the anxiety
Yeah,
because he's
true.
using the marijuana to medicate the anxiety.
So another question is, have you noticed in your career that you mean like for me, I've never seen so many kids with anxiety issues ever. Like the last 3, 4, 5 years, and just my own experience. Maybe I'm not a doctor. I don't know what I'm talking about. So if anybody's like, "You're stupid. You don't know what you're," I don't know what I'm talking about because I don't know the exact facts. But based upon my personal experience, talking to families, etc., I'm seeing kids at like 10 years old being diagnosed with super high anxiety. I've never even knew that was around. Like when I was a kid in 84, when I was born, we don't talk. Maybe it's because we didn't talk about it. Is that, did it just magically blow up in our faces because we didn't deal with it, or was it always there?
Well, I can tell you that what the research is showing that for 10 years prior to the pandemic, for 10 years,
Yeah.
we had begun to see an alarming crisis in adolescent mental health. It had already been going on for 10 years,
Oh wow.
where kids were reporting increases in anxiety, in depression, in suicidal thoughts, and showing up at the emergency room in a crisis situation. And then the pandemic comes along, and the pandemic just increases all of that. And I think we're just now beginning to understand what the pandemic did in terms of both adults and adolescent mental health, because kids were reporting, no, higher levels of anxiety during the pandemic years, higher levels of depression, higher levels of being isolated. So the pandemic took what was already a crisis in mental health among adolescents and just
It just bloomed it. It
it
just
just
bloomed
blew.
it a bit
Yeah,
more.
yeah, it did. Um, a- and 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 I think a lot of that has to do with the fact that kids were pulled away from their social environment. They were pulled away from their friends. They were isolated at home. Many of their parents were going through a crisis themselves. Many of them had lost their jobs, or there was a significant change in their jobs. Kids began to worry about their parents and their families and themselves and their friends, and it just caused an increase in things like anxiety and depression, feelings of loneliness. And hopefully, as we're moving past this pandemic, we're starting to see that come down. Now, the flip side of that is that during the pandemic years, we saw a decrease in adolescent substance abuse. The percentages of
Hmm,
kids using drugs went down during the pandemic,
interesting.
whether it was alcohol or marijuana. For example, the number of high school seniors that were using marijuana dropped from 35 to 31%. The number of kids drinking alcohol dropped from 55% to 47% among high school seniors. And I think a lot of that had to do with the fact that they were pulled away from their social environment, their peers and their friends, and just didn't have opportunities to be around other kids that might be drinking or using substances. And we'll know in about a year whether or not, now that they're back into their regular school routines, whether or not that decline is maintained, or if kids went back to using
Goes
substances like
back
they
to the
were doing
curve,
before.
back to the
Exactly.
curve of what it
It,
is. Now,
yes.
one thing that is emerging, and I don't know if you have much experience with it, is this whole digital age. And what I mean by digital age, I mean you have things called, like I remember playing on the, Game Boy, right? It wasn't really a big deal to, but now you have ecosystems of gaming communities linked from, from here to South Korea to Australia to anywhere, and playing different types of games. And no, and then you have a virtual space, the metaverse, that people are calling this whole. It's like a Sim City, but more virtualistic, that you're in.
Yeah.
Now, what's your take on that? Is that something to be like, I think that's maybe not the right place to go, or is that, hey, a little bit of balance? Like, what's your scientific or objective approach with gaming, and the metaverse, virtual reality?
Well, I've had a few, not very many. I've had some adolescents that were uh, compulsively using video games, and it became as compulsive as a kid that might be compulsively using a substance. It has many of the same characteristics in that it gets out of control. They can't control their time. It causes conflict with their parents, but really not very many. I think a deeper issue, and I'd be willing to talk more about this at another time if you're
Of course.
interested,
Yeah.
is social media and teens. I think that's becoming more and more of an issue of kids getting involved in things like Facebook, um, Instagram, TikTok, and things like that. And that's another issue that parents need to be.
We can talk about it in another time. I think
Yeah,
social media and kids, I think
yeah,
definitely where I'm going to have you on board at another time, and we'll
yeah.
set that up after. And for one last question, for
Sure.
parents who are having issues with their kid, or they're they're thinking, hey, I don't know what to do. You know, like my
Yeah.
kids just either has the issue or they don't know how to approach it. Is there one advice or one little tip that you can go, hey, I get it, try this and start there?
Yeah, I have two suggestions. First of all, get a copy of my book, so that you are aware of the warning signs. You are aware of what tests and assessments you should get done if you think your child is using a substance. What
That's
are the
help
assessments?
the and that's helptheaddictedchild.com. Is that correct?
Yes, sir, that's correct. And also it will help you if your child needs treatment. It identifies in the book the different types of treatment that are available, the kinds of questions you should ask a potential treatment provider. It'll give you some basic information about how the brain works. So I would recommend that every parent, no matter what your child, no matter the age of your child, get a copy of this book. I kept it to about 100 pages because parents are busy. They don't have time to read volumes of
Of
information on this.
course.
So I kept it to about 100 pages so you can read it very quickly, keep it on your bookshelf, keep it as a resource, maybe loan it out to another family. But my goal is that parents who read this book will feel more confident, less paranoid, less afraid, and feel as if, okay, I've got this. I hope I don't have to deal with this issue, but if I do, I feel like I'm prepared to deal with it. And the second thing I would say, Chris, is that if you suspect your child might be involved in using a substance, the first thing to do is have a conversation with your child. And by that, I mean, don't accuse them, don't threaten them, don't punish them. You want to come at it from an inquiring point of view. In other words, I'm seeing these behaviors. Can you help me understand why I'm seeing them? Or I'm concerned about what I'm hearing and what I'm seeing. Can you help me understand what I'm seeing or
Yeah,
what
I
I'm
would be coming
hearing?
across as a dictator or Hitler. Not knock on that, not that person, but a very authoritarian base. You know what I mean? Like, and I'm realizing that's maybe not the best approach.
Well,
Yeah.
the other thing I would say is that we're very good at listening to each other's words when we're talking. So when we're talking to our kids, we're pretty good at hearing their words. We're not so good at hearing the feelings behind those words. And that's a
Mm.
skill that every parent can practice and every parent can learn. So that when we're listening to our children, we're hearing the feelings behind those words and we're reflecting them back to see if what we're hearing is correct and if what we're sensing and what that child is feeling is correct. That can be very powerful when talking to a child because they begin to sense that you're interested not just in what they're saying but in what they're feeling, and that's a skill every parent can learn.
So parents out there, listen to your kids' feelings, not just their words.
Yeah.
From Mr. Richard. And if you guys are interested in his book, go check it out, helptheaddictedchild.com. We'll have all the links below underneath this video for anybody interested. Thank you again, Richard. It's always a pleasure. And we're definitely going to have a chat about social media and kids because I think it's a topic that we need to discuss. It's one of those things that we need to bat out of the park.
Thank you, Chris. Appreciate you taking the time to talk to me, and be more than happy to talk to you about social media at some time in the future. But thanks again for your time. I appreciate it.
Sounds good. Thanks, Richard.